Good morning. I'm joined by Adrian Zacher and Dr András Bikov for another 5 minutes with, and we'd really just like to begin by asking Dr Bikov to introduce himself and tell us a bit about himself. That would be great, thanks.
Hi, my name is András. I'm one of the respiratory consultants at Manchester University Foundation Trust. I'm also an ESRS certified somnologist, and I do have a special interest in sleep-related breathing disorders.
Have you had much of any thoughts on the Awake Check study and what we're actually trying to do with our current research team?
So I did look into your website, and I find it is important to pre-screen patients for both sleep apnea and insomnia as well. So we know that these are two very, very common diseases, but often these patients are seen by different professionals, and there is not always a comprehensive assessment for insomnia if patients are referred to a sleep apnea service. And vice versa, if the patient is referred to mental health services, which traditionally cover insomnia, sleep apnea may not be asked. So we know that both of these disorders are very common. So they both affect at least 10% of the general population. We know that there is association between the two disorders. So we know that insomnia can contribute to development or worsening of sleep apnea. And we know that one of the symptoms of obstructive sleep apnea could be insomnia and not necessarily excessive daytime sleepiness. But also these two disorders can coexist. So there's no need to have a link between the two disorders. So in some patients, there is a strong link. In other patients, they are discordant. However, both of these disorders are associated with increased cardiovascular risk. Yeah. So obstructive sleep apnea is associated with hypoxia. That is a link to cardiovascular disease, and insomnia is associated with sympathetic hyperarousal, and sympathetic system activation is leading to development of cardiovascular diseases. So actually being aware of these two disorders, selecting those patients who would benefit from intervention on either or both is very important. And I found your study is the first step to at least identify those patients who do not suffer from only one disorder, but both of them.
We're actually really fortunate in this morning, we just hit 1,000 participants in the study, and this is just week 9. So we really need to get to 5,000 participants across the UK in order to actually even begin to talk about the word prevalence. So we're really trying to push the participation as much as we can with the social media platforms that we're using. Adrian, have you got anything you want to add?
No, that's fantastic. I mean, the point I would add would be this is an unfunded study, and you know we do this because we want to. I think the stop bang and the ISI that are used certainly, as you say, are a good first step. But the other objective is this, as Phyllis says, is to get to a prevalence estimate. Yeah, something that we really need. Let's wind this up and let you go.
Yes.
So Dr. Bikov, thank you very much.
Thank you so much. A pleasure.
5 minutes with.
All right.
Take care.
See you.
Bye-bye.
Bye.
Bye.
Bye.